In our previous conversation, we talked about who benefits from reference-based pricing. Jen, can you talk a bit about reference-based pricing models SHP works with and what SHP offers?
Absolutely. Security Health Plan and Security Administration Services has better alternatives available to you. Two of those models, one will be fully insured, which Joan will talk to you about in a little bit. And what I'm sharing on my screen today is our Security Administrative Services, where we are a TPA for self-insured plans with third-party administration, which is what TPA stands for. With our TPA, you can choose excellent provider networks that have 100% guaranteed reimbursement terms secured by signed contracts. This is very important to keep in mind because of the fact what we talked about earlier with those balance billing is that our contracts here with Security Administrative Services are secured. And they are signed contracts that we have for our members and our groups. We have price transparency on all of our admin fees, associated costs, monthly and on demand or as needed reporting is available to all of our employer groups through Security Administrative Services. The employer has the control for self-insured. They can design the health plan. We can work with them and partner with them. They can pick the network. They can pick their pharmacy benefit manager. We work with them as their guide and their broker to develop the best benefits for them and use the networks that's going to provide the best pricing and transparency for their members, depending on where their spend may be. So Security Administration Services is one of our better kept secrets that we have here at Security Health Plan, but connect with us, do those pricing, look at our services that we have to offer. It's the same services that we have available on our fully insured, but the employer has more control because they can design and pick and choose what pieces they like, especially those networks that are secured by signed contracts. Now, Joan will talk a little bit more about what our alternatives are with fully insured.
Thanks, Jen. Our fully insured plans are offered for employers of large and small employers. We offer a large group product for employers that have over 51 enrolled, and then a small group product if they have less than 50 enrolled in their ACA compliant plan. The plan designs are all with contracted providers. So our fully insured plans are never going to put your member in the middle of a dispute between the provider. If they go to an in-network provider, they always have that protection. The lowest costs with the exclusive networks. So we have some networks that are a little bit narrower network that give people the best price point. Those are Simply One, Enrich, Inspire, and Reliance. Those network plans also have contracted providers, have the highest negotiated discount, and are going to give the members the most out of their plan design. Our benefits are really designed to incentivize healthy behaviors and the lower cost overall. So we're going to make the plan the best plan for your employees, as well as help them be healthier in the long run. Care My Way is a great example for a benefit for the employer and the employee. Care My Way gives you a resource to have a doctor visit over the phone, possibly get an antibiotic, and you don't even have to leave work if you're at work. You just have to call in. You also have access to that 24/7, 365 days a year in all 50 states. It's a great resource to have a non-doctor visit, but to receive medication when you do need it. Medication therapy management is also a great resource. We have pharmacists on staff that will go through the medication your employees are taking. It will give them a resource to help them make sure they're taking the right medications, that their medications don't interact adversely with each other, and that they're on the right track to being healthy. Care management is also another great resource for those that have maybe a complex medical condition or need disease management for diabetes or something like that. We have awesome nurses that are going to help them make sure they're getting not only the best care, but that they're compliant with their care. They're taking their medications, they're doing the right things, and they're controlling what they can control with their diseases.